Good evening, ladies and gentlemen. Welcome again to 103 FM's Men's Health Clip Hour. I'm your host, Dennis Webster, and joining me again in the studio is a medical doctor and attorney, Dr. Flavio Cardone. Welcome, Dr. Cardone.
And hello again, Trinidad.
I would like to remind our listening audience, as we always do at the beginning of our show, that you should always seek the advice of a physician or other qualified healthcare provider if you have questions regarding a medical condition, and that you never disregard professional medical advice or delay in seeking it because of something you've heard on this program. Today we're going to be discussing a topic that's kind of dear to my heart. It's called evidence-based decision making. Now, really, the healthcare that we're getting in our country these days really depends on where you go and what standards they have in place. Sometimes there are no standards. So we're going to discuss, how do you know if you're getting the very best care possible? In order to be credible, healthcare professionals must demonstrate effective integration of evidence, including research findings, into their clinical decision making. Now, I don't know if that happens a lot. I have not observed a lot of it myself, so I think that's one of the problems we have. And Dr. Cardone is going to probably help us shed some light. Dr. Cardone, why don't we have standards in place? I mean, I'm familiar with standards, working in Canada and in North America generally, and I know they're kind of consistent with the standards that also in Europe. Why don't we have them here in Trinidad and Tobago? Like, what's going on?
Well, I think first we should say what is evidence-based medicine and the difference between evidence-based medicine and the medicine that was before. Mm-hmm. So before, medicine was given according to what the doctor thought was best, but very often there was no real study to see if a drug really worked. So the doctor only knew that, let's say, captopril lowered the blood pressure, and that's because he was told so by his professor. That's because in theory it should work. And drugs were being given without actually testing whether there would be some final effect on the people taking the drugs. So, for instance, not only drugs. So, for instance, people thought that having a special coronary heart unit at the hospital would improve the care. Mm-hmm. So everyone thought it was a very good idea, but then somebody thought, well, let's see if this actually is true. Mm-hmm. And then they found out that the mortality was greater when they had special coronary care units. So,
yes.
So evidence-based medicine means testing everything to see if it's actually true, because let's say we could think, like the famous everyone says vitamin C works when people have a cold.
Right.
So people think it's universal knowledge. Then let's see. So you give 1,000 people to drink either water with sugar, placebo, or vitamin C, and then you see if actually there is a difference in percentage.
Right.
And then they saw that the percentage of people getting sicker or better was the same in both groups. And then you see that it doesn't work. So evidence-based medicine, evidence-based decisions are not the ones taken just in consideration because somebody told you, because you think it's logical, okay, lower blood pressure, they'll have less problems with the heart.
Right.
No, these things have to be actually tested, and then people would see if they actually work. So
the reason for clinical trials, and it's important to have clinical trials and testing.
Yes, and in fact now, let's say the most expensive part in developing a new drug, I wouldn't say the most expensive part, the very expensive part is actually testing the drugs, because you need to have really such a large group of people that you're able to see whether this actually works. Because you see, the problem is that especially people who are not medically trained, they will think, well, my friend had something similar, took this pill, and it worked. Yes, okay, it worked in one person, but you have to see, let's say, out of 10,000 people, whether it works, in how many it will work. Something
so it doesn't necessarily going to mean that it's going to work in the general population.
Yes, and also, what people do very often, they, let's say, suppose they have a cold, and they go to, it's a viral infection, and the doctor knows it will last a week, and tells them, just rest and drink fluids. And then they think, well, the doctor didn't give me any real medicine, but a friend told me that if I drink some paint, I'll get better. They drink paint on the last day that the cold would last anyway. And then they think, well, this really worked, and that's the trick the doctor didn't tell me. But, they... it's not like this. It's not...
That's not how it works. You're listening to 103 FM. You have three options if you'd like to be part of the program. You can give us a call at 628-4103. You also have the option to log on at 103fm.net, or you can send us a text at 4103. Like, what has been your experience, as far as this evidence-based decision-making, Dr. Cardone? Like, how important is this that we get these standards established in Trinidad to actually, make this medicine work?
Oh, it's essential, because otherwise you won't be really practicing medicine. It starts to become something a bit like magic. I'll give you this thing, and it's going to work because I say so, and not without any proof that it actually works. I have heard, people have told me they went to the dermatologist here to get some cream because they had some skin, and the dermatologist gave them a pre-mixed,
concoction of something.
Yes, and said, well, I'm not telling you what is in there because that's my secret formula, and you put it on the skin and it will work. And I know you pay me 500. But this is crazy, because how can you get something on your skin without knowing?
But aren't you supposed to know? Isn't he obligated to tell you what the ingredients are?
Well, I would think so. I would hope so. But apparently, he was able to say, no, that's my proprietary formula, and I can't tell you what is in there. And this to me seems completely crazy. It's
there's no constructive approach to
yes, the things should be properly tested, and you can't do something like this, and because not following evidence-based medicine is something completely illogical. So, like, somebody here I know, they had his wife had Zika, right? And Zika tested properly. Lab results confirmed 100%. Then they said they were going to come and spray his house. And, well, first it's strange, why would they spray only his house? Like, the mosquitoes could be from the house next door, but that's okay. Then they don't come to spray his house. And when the daughter gets sick, with the same symptoms, they say, oh, well, we don't test you because you don't fit the profile. So, evidence-based medicine is so logical, but you need people who think in a logical way. If they just do, things without thinking, that's when you have problems, because then it's like, it starts to get like magic, not science. And also, of course, as we say all the time, you open the door to a possible lawsuit, which is actually easy to win, because then you show the doctor was doing things not based on science,
evidence,
but based on whatever he was thinking.
Right. It doesn't make a lot of sense. I mean, like, it's almost like you're shooting in the dark, hoping to hit something. It's a really crazy way to move ahead, and a lot of that's happening. I mean, I saw one gentleman who said, well, he went to see his doctor. He had a problem with erectile dysfunction, and he was diagnosed as having thick blood, and told to take aspirin for 7 days. Like, that to me makes absolutely no sense at all. Like how can something like that happen in this day and time?
Well,
I just don't get
how
it.
can something like this happen? If people don't complain, if people just, don't do anything, they don't make a big fuss about it.
Mhm.
They think, well, that's the way it is, that's the way it has always been.
Right.
And you can't say you have thick blood. Well, I don't know what he meant there.
Well, I was lost myself. Yeah, made no sense to me whatsoever. I've never seen that in my practice, and obviously you haven't seen it in yours.
No.
But it's not. It's like things are just going too crazy. It's out of hand now. Like, how do we get these standards in place where people are following, evidence-based science to, before they're managing, their patients.
Well, the thing is that, there are so many illogical things going on that this is the problem, because if people don't react to this, if people don't do their part in questioning things, and there is a way of accepting anything here. So I've known personally of there are very good doctors, and there are also very bad ones. But I don't see. You see, the good doctors don't get any special reward other than having more work to do,
Right.
because they take longer to examine the patient, they talk to the patient,
Right.
and so they get more work. And I've seen bad doctors getting away with anything. There's a case of a doctor who punched another doctor, and the first one got suspended with pay. So they gave him a free holiday. So that really doesn't help you. Try to work harder as a doctor, and don't think this is Trinidadian doctors who are not following
Procedure.
this. This happened. This, for instance, was a foreign doctor, and nothing happened. Basically, they got away with that. And sometimes, but on the other hand, now let's say something good. You have excellent doctors here in Trinidad who apply the proper standards of care,
Right.
who try to do everything exactly as it would be done in Europe or the United States. But unfortunately, you have to be lucky.
Right.
You have it's like a lottery. Also, as I say sometimes, I mean, I'm a foreign doctor myself, and you can have some that are excellent and some that are very bad.
Right.
For instance, I know two of excellent doctors, and you would think that both of them come from Eritrea, which is a very poor country. One is called Daniel, the other is called Samrewit, and they are somewhere in the south. And they are excellent doctors. They really follow the latest things.
Right.
And you wouldn't, you would think they come from a very poor country, that they wouldn't do that, but they are. So it's not a question of Trinidad needing special resources or extra money or something like that. It's having the doctors keep up to date to what is going on, because if doctors here, once they become doctors, they're doctors forever.
Right.
They don't have to take further exams, they don't have to do anything, and they'll keep practicing if they want. They don't need to go to any conference. They'll keep practicing medicine as it was 30 years ago.
Right.
And they won't stay current. So I would think the main way to keep to make sure that doctors are following evidence-based medicine is to do something like what they are doing in England now. The doctors have to be evaluated every year,
Right.
and if they are not evaluated every year, then every 5 years they make them take an exam.
To make sure that they're still
Yes, that
current
they
with
know
what's going on.
something.
You listen to 103 FM. If you would like to be part of the program, you can give us a call at 628-4103, or you can log on at 103fm.net, or you can send us a text at 4103. You're listening to the finest. We'll be right back. Welcome back, ladies and gentlemen. You're listening to 103 FM's Men's Health Clip Hour. I'm Dennis Webster, and joining me is Dr. Flavio Cardone. Tonight we are talking about the importance of evidence-based decision-making. You go to your doctor, how do you know you're getting the very best care possible? Is your doctor following, international, guidelines as to how you're managing your health? We want to hear from you. What has been your experience? Do you have any ideas of, what needs to be done to get, our country, up to standard? You can call us at 628-4103, or you can log on at 103fm.net, or send us a text, please, at 4103. We'd like to hear from you. Dr. Cardone, so how do we get, the government bodies to get these things in place, like doctors to have maybe continuing medical education requirements, things like that, to raise the standard? Because, we can't go on like this forever.
Well, let's say the final responsibility is with you, the Trinidadians, who vote and who choose the government, and who should, pressure the government into doing that. Because change only happens when there is a force being applied. Otherwise, things stay as they are. So,
But we take it for granted, though, that the government knows, what to do.
Yes, well, maybe the government knows what to do, but the question is whether the government wants to do the proper things or not, because it's a lot more convenient to leave things as they are. Doctors are happy, they make their money.
But what about the suffering of citizens? Our citizens...
Well, but the citizens, if they don't complain, if they think, well, that's okay, it's okay that I have to go at 5 in the morning to the... If I have to go at 5 in the morning to the hospital to be seen at 8, if they agree with that, then there's no... I think we have a message.
We have a text here. The text is, do you think evidence-based medicine exists?
Ah, okay. Well, do you think evidence-based medicine is used in Trinidad? Sometimes, depending on the doctor you get. But
well, that's the whole thing.
Yes, it should be a standard. It shouldn't be.
But how does someone know? How does someone know that they're getting, the standard of care?
Well, that's the problem, because nobody actually enforces this. The medical board could ask for an exam or something. Actually, I think they would have the power to have that, asking people to be revalidated every 5 years or something. But that, of course, it has to be somebody who has the strength. I was about to use another word. Let's say the strength to do these things, because it's very nice for the doctors not to have to study anything to be able to do the things the way they do them, because studying takes time, takes money, and doctors would rather on the weekend or in the evening do something else and not study about drugs or treatments.
Right.
But if nobody makes them do that, some have a very good conscience, like those two ones I told you about who come from a very poor place. They you would think they don't know much, but they know the latest things. You get so surprised.
Right.
But that's because they have a conscience and they want to do that.
Right.
So I know one here who also is excellent. She reads all the newest things, and find out we read more or less the same news at the same time, because the next day she mentions, the newest studies. But
it's important that we find out who these are. I mean, they need to become commended for their great work, and we also need to find the ones that are actually not up to par.
yes, but you
And
see,
it's
but
a
the
safety
problem
issue.
the problem is that good work is not being rewarded, and bad work is not being punished. So with time, the doctor who keeps up to date, who tries to do everything proper, everything that takes a long time, he starts to look like the stupid one, the one who works the whole day
Right.
instead of finishing at 11 in the morning.
Right.
And then there's no incentive. The doctor who doesn't know much will get the same pay as the doctor who's doing everything properly.
Right.
Except that the doctor who's doing everything properly will work twice as much and will have to pay for conferences, textbooks, and everything.
So you're saying there should be some sort of reward system for those that are really performing up to par.
Yes, but that's of course difficult to check. But for instance, in some countries they have started publishing statistics of mortality.
Right.
I think we have a call.
We have
now.
a caller. Yes, you're listening to 103 FM's Men's Health Clip. You have a question?
I do.
Go ahead.
It's regarding evidence-based healthcare,
Mm-hmm.
and this can apply to all healthcare providers.
Mm-hmm.
Who am I speaking with?
My name is Dennis Webster. You're here with me and Dr. Flavio Cardone.
Okay.
You sound like the Canadian caller.
It is. I
Yeah.
recognize my voice.
Thanks for supporting the program.
So my question is, evidence-based healthcare, this can apply to all healthcare providers, not just physicians, but also
Absolutely.
nurses, counselors, physiotherapists,
Right.
etc.
Right.
And when change is required, there's a need for change champions to come forward
Mm-hmm.
in the overall system.
Mm-hmm.
And these champions can exist in government, the university that educates physicians, nurses, pharmacists, health educators, etc., and the consumer of health care.
Right.
There are standards throughout the world that could be applied in Trinidad with confidence and yield better treatment options.
Mm-hmm.
How can the consumer be educated and supported in moving forward to better health care in Trinidad and Tobago, in your opinions?
I actually didn't understand too much of the question. You're asking how
But she's saying that the standard applies not just to physicians, but
no,
also to other
sure.
And how do we get consumers? Ma'am, can you ask your question again so Dr. Cardone can hear you?
There are a number of elements within this.
Are you there, dear?
Yes. How can the consumer be educated and supported in moving forward to better health care in Trinidad and Tobago?
Well, I would say first, we shouldn't call the patient a consumer or a client, because a client is someone that you don't have any emotional attachment to, and you should care about your patient. That the patient gets better, that you care about what is going on with him, because a client is to me somebody who goes in a shop, buys a thing, goes out, and then you don't care about them at all. So I would rather stick to the
You're talking
patient.
about the consumer. That's the consumer.
Yes,
yeah.
yes. But I would stick to patient, because patient gives a certain emotional attachment which you don't have with a client. With a client, you don't care. You sold him whatever you had to sell. Well, how can they be better educated? Well, that should start in school, because that's where they would learn, how to eat properly. They would, to have some overall general education. But I think having, education campaigns on what should the standard of care be.
Mm-hmm.
If people don't complain, if people don't do anything, and they accept anything, and if they say, okay, we know what it should be, but it's okay. When we need something like this, we go abroad. Then things will stay as they are. They must be educated also to exert their rights, to enforce their own rights. And that is something, governments rarely want to do, because for the government, a passive citizen is much better than the one who complains, who looks for...
who's looking for what he really needs.
Yes. So I think it would be a very complex answer to that. We'll have to change the whole mentality of...
Well, yeah. So and I know it's a challenge in Trinidad and Tobago, because the consumers, as she referred to, they actually don't know what the standard is. Now, it's unfortunate, because with the advent of the internet and technology, people have more access to information. So it's not that I don't think it's that people don't know what the standard is. It's getting the standard when you go for care.
No, and also what the caller said about the champions of change but the problem is that, you see, if the champions of change get rewarded or have some incentive for doing things properly, then okay. But if the reaction is more or less, as the Chinese proverb says, I think it's Chinese, the nail that sticks out is the one that gets hammered first. If that's the way they are treated, then they won't. Why should they try to make this change? Because after all, there can be one doctor trying to do everything properly. But then that one doctor, maybe has children, has a family, has everything, and he sees that for the same pay, for the same everything, he's staying until late at the hospital, spends the weekend studying. So at the end, it's not
worthwhile for him to.
People are human. They see everyone else enjoying their life, and it's difficult to be to try to change something. It's very difficult to try to change things that when people don't care about changing them. So
you're saying we have to have more caring for change? Or?
Yes, people should have more, let's say, more conscience of their power, of what they can do. That's why I always say, sometimes you ask me, well, what should be done, who can do this? And I always say, well, on the radio and out of the radio, I always tell patients, also when they come to me at the hospital and they say, well, but why is this thing going on? And then I tell them, well, you're the ones who can vote here, so you're the ones who can do something. If you don't react by changing your vote, by doing something.
But we vote. But you put in. They tell you everything before they get into to power. They'll say they'll do this, that, and the other. But as years from one administration to the next, things are basically remaining the same. I think in many cases, probably even getting worse. So. Voting is one thing. Saying, go out there and vote for this particular party or whatever, they're going to bring about a change. They tell you that at the beginning, but
yes, but when I say vote, I mean also complain after when things don't go well.
Yeah, I think we have another caller.
Okay.
Yes, you're 103 FM's Men's Health Power.
Hi,
you have a
good
question.
night.
Good night.
I'm listening to your program,
Mm-hmm.
and I want to commend you. You guys have a very good topic going.
Thank you.
I just want to interject in a few areas.
Mm-hmm.
Are you hearing me?
We're hearing you clearly, yes.
Okay, good. So, you're talking about change,
Mm-hmm.
and we're talking about champion for partnership.
Right.
Then we talk on the topic of is the government really interested in
bringing about this change?
Bringing about changes.
Mm-hmm.
Yes, that's right.
Mm-hmm.
Okay. With respect to champion of change, what happens in Trinidad and Tobago is that if I have a problem that affects me and my family,
Mm-hmm.
people have a mentality in Trinidad where what doesn't happen in their backyard, it just simply does not concern them.
Mm-hmm.
And this is why it's hard to bring about change in Trinidad and Tobago.
Mm-hmm.
And another thing is that policies need to be reviewed where a medical board is concerned, starting from the top come down. Because, I mean, if you need changes in Trinidad and you can't get changes from within at the very top, then how is it going to come about? Where concerning doctors and their patients, I think doctors should make their patients their primary priority, paramount to anything else. Sometimes doctors tell you some things that they know that they have two minds about a situation or issue that concerns your health, and they're not going to come out and tell you the truth. And, well, if you guys ever heard the expression that Trinidad is paradise, these are the things that people tolerate here that makes it paradise. Because literally we can do anything here. And I said we because it's a holistic problem that we have.
Right.
Literally, we accept these things and we don't come forward for change. For instance, if I want change and I take a placard and go stand at the side of the road, I'm not going to get people to support me. I'm going to get somebody calling the police to come and get me out of there.
Right.
And this is the mentality that we have here.
Right.
It was an old phrase that we have a 9-day wonder mentality here. It seems to have become, over the years, a 3 or 4 days mentality. Thank you guys very much.
Thank you for your call. Thank you for your call.
With your knowledge and with your focus and interest that you have, I think it's a very good that, we need some kind of office here that we can come to for these kind of things, like change, and someone who really wants to take that standard to say champion for change.
Right.
We also need a medical review board. We need a proper diagnostic clinic where people who have, like, for instance, they want to get certain medical reports. Say, for instance, like if you have a case, a high court case, or a medical...
So you're talking about second opinions and things like that?
Yes, correct. Thank you.
Right.
We need an office where we can go to for these things here in Trinidad. Thank you very much.
Thank you for your call. Thank you for your call. Yeah, people are frustrated.
Yes, I agree with a lot of almost everything, if not everything that the caller just said, and this that the doctor, yes, the change should come from within, as she said, from the medical board itself, and I also agree there should be some office to do that, and also, the patient should be the priority also of the doctor. I agree with that completely. But now we must have a break.
Yeah, you're listening to 103 FM. We're going to take a short break, and we'll be right back. Welcome back, ladies and gentlemen, to 103 FM's Men's Health Clip Hour. I'm Dennis Webster, and with me in the studio is Dr. Flavio Cardone, a medical doctor, as well as an attorney. Dr. Cardone, as you can hear, people are frustrated with the quality of care that they're getting. I personally, in my own business, I have seen, some of the problems that we have, and we need to rectify. I think getting a proper diagnosis is a big issue, and I think that's something that needs to be addressed. I've written about this in my columns about the importance of getting a right diagnosis and a second opinion, but I've not really heard from anyone, especially at the government level, with regard to what their plan is to basically resolve some of these issues.
I would rather actually go back to what the caller said before, that the doctor has to see the patient as the priority.
Right.
Because that is also a very important thing, because I see sometimes too that we have the CDAP system in Trinidad. This is a chronic disease assistant program.
Yes.
So people who have chronic disease can get some medicine for free. And you see sometimes doctors giving the patient some medicine that is not on the CDAP, medicine that they will have to pay for it, and then that the patient will not be able to afford that medicine.
So why are they doing that?
Who knows why they're doing that? Who can imagine why? I don't know why, but
But
probably. I think some pharmaceutical companies advertise very well, and it's relatively easy to find out for them which doctor is prescribing what medicine, and they could be getting, rewards for this. Or also they really don't care a lot and they just give that medicine for whatever reason,
Right.
which is not, of course, evidence-based, because evidence-based medicine also has shown that to improve on compliance by the patient with the doctor, you should make it easier for the patient to take the medicine. So
Right.
instead of giving something to be taken 3 times a day, then you should give something to be taken once a day if available. So
I notice that a lot, especially with the men who are being treated for metastatic prostate cancer, getting injections. I mean, there are different injection schedules. You can get it from 1 month to 6 months, and you see a lot of them getting it every month when they really can get it every 6 months. So, and I don't know why that happens. I've questioned it. I've had no really answers to why that's happening. But there are preparations right now that men can take once every 6 months, and they don't have to take an injection every month. So I don't know why we don't have these things happening on a regular basis.
I would say probably as we were saying, the doctors are not here required to study. They're not required to know the latest things. So
you think it's a lack of knowledge that this is how it happens, or?
Mostly, because I wouldn't say it's a conspiracy because the pharmaceutical companies pay them or something. I think it's just, they because you are in a way specialized in prostate, but the, let's say, average doctor is not. So why should and especially with this system that the doctor who studies, who spends his time getting better at medicine, ends up for the same pay working a lot more than the others. So there's no incentive to know about these things. Also, it's a lot easier to give the usual thing everyone is giving, instead of making some change that may not be followed. Also remember that here, when people go to see their GP at a health facility, especially in large places, let's say Port of Spain, Arima, San Fernando, probably, they won't necessarily see the same doctor that they had seen before. So they may get a doctor who has read the latest thing, who will give them, the newest medicine, and then they come the next time, and there will be a doctor who will think, well, what is this thing, and will give, what they have been used to. I saw myself, let's say, a foreign doctor giving someone some medicine at 10 times the normal dosage, but luckily for the patient, this medicine doesn't exist in Trinidad at all. So
he was saved because he couldn't get.
Yes, so you have all these things going on,
right?
And people complaining about this, and nothing happening. Nobody is actually, punished or something.
Right. So there's really a huge lack of accountability also.
Yes. So so the doctor who tries to do things properly ends up, looking like the stupid doctor. Why am I working, 10 hours a day when the others work 4, and
we all pay?
Yes. So of course, having a good conscience
does help.
Yes, but.
You're listening to 103 FM's Men's Healthcare Power. If you'd like to be part of the program, you can call us at 628-4103, or you can log on online at 103fm.net, or just send us a text at 4103. We are discussing this evening evidence-based decision making. What sort of care should you expect when you go to see your physician? Question is, is your physician or other healthcare provider current Do they have? Are they following any guidelines, international guidelines, with regard to your care? So these are all important issues. If you have an experience that you'd like to share with us, please do so. We're here till 10, and we don't take any calls after 10. So, call in now. Dr. Cardone?
We also don't take any calls after 10 because we won't be here.
We won't be here, exactly.
So, yes, the problem with this evidence-based medicine also is that, people have to be really following the studies, because also with evidence-based medicine you will see that there are different kinds of studies, that not every study is a proper valid one that justifies something.
Right.
So evidence-based medicine has shown that actually a randomized trial where you have 1,000 people getting either a sugar pill or the proper drug, and they don't know what they're getting, and the doctor doesn't know that, and then seeing if there is any difference in the groups, then you see if something really works.
Right.
But but let's say expert opinion is actually low on the scale of the strength of the recommendation, because expert opinion without any test is not considered a very valid thing. Things should be tested. And of course the caller before asked if evidence-based medicine should apply to everyone who deals with health. Yes, of course, there are studies that show what is the best way to the best angle for the bed for the patient has a certain condition. There are studies that have shown what are the best practices for nurses, for hospital cleaners. So for instance, there is a famous hospital in Europe where once a month everyone has the right to say, there's a meeting with everyone from the cleaner to the professor who runs the hospital, and everyone can say what they think should be improved. So for instance, the cleaners there said that corners at the hospital makes it harder to clean everything. So there they started to have round corners. Right. Also where the walls meet the floor, it is rounded, so it's easier to clean. But to reach that point that everyone is equally considered an expert in their field. So the cleaning lady is the expert in cleaning, and she's accepted as such. She's not worse than the doctor, and the nurse is not better than the doctor or the cleaning lady. Everyone has their specialty. Right. It took them almost 20 years to reach that, because people were afraid to speak. People had the mentality that if I speak, then they'll laugh me out, and I don't know, I'm a nurse, I can't give an opinion against the doctor.
Considering that governments are responsible for making policy decisions to improve the quality of life for individuals and the population, do you think maybe a good idea, a good start probably would be to create maybe forums where people can come in and basically express, maybe their ideas and how we can bring about change and how we can start getting this whole process going?
Yes, that's a very good idea. They could have even, an internet forum about that. But people shouldn't be afraid of saying what is really happening. Right. They shouldn't be afraid of saying names, because legal advice. If you write something about someone and it's true, then it's not libel. It's not. If you're writing the truth, then don't be afraid he'll have a lawsuit or something. Right. You can write Dr. So-and-so is a bad doctor because But then also, one problem they have in Europe, that there they have these forums, but the thing has been in a way perverted such that people can buy good opinions or bad opinions against their competition.
Right.
So when the forums started, first people thought it was an excellent idea. People were giving ratings to doctors, 5 stars, 1 star.
Right.
But the way it is now, doctors can buy packages of stars. So you can buy 100 5-star votes for you, and 100 1-star votes for the doctor who is across the road.
Corruption is even in that.
Yes, so that thing already, they found a way to ruin that too. But in many of these online things, it has been seen that in Europe that they buy packages of likes, packages of stars, and you can buy them on the internet. So I used to live, I'll go back there in a few weeks in Poland, and there they have an internet service called, I think, Doctor's Opinion, Famous Doctor. It's in Polish, not in English, of course. There people vote stars and everything, but in that thing, for instance, they have conferences and people come to you and say, well, I'm selling 100 stars for you. But luckily, you don't have to be there. You don't have to be a member of that thing. So I'm not. So nobody can put stars or anything. I'll have less publicity, less advertising, but I think it's better like this. I think if I'm good, people will know about me, and I won't need to advertise myself so much.
But it's important people talk and people express, their experiences and let.
Yes, that's a very good idea, and in fact, doctors are in countries where something can actually happen. Doctors are very much afraid of having negative things exposed on the internet, because then an official from the government will go and investigate that to check if what they're saying is true. But I don't see it happening here. People here, they complain, and then
but there's no investigation into.
Yes, they just
So that could be one of the things that could probably be put into place. Maybe the government could look at something like that, because we have a very frustrated population with regard to healthcare, and we need to make some changes.
And we have a call now.
We have a caller. Caller, yes, welcome. You're on 103 FM's Men's Healthcare Power.
Yeah, hello, good evening.
Good evening. Thank you for calling.
I'm actually listening to your program. I'm from British Strange, from London, England. I was speaking about research. There's a lot of research I know from BMJ, British Medical Journal, and Nursing Journal International, which can be read and sought out with the local journals. So there's a lot of educational journals you can look into. We have a lot of meetings. I may say recently I came back to Trinidad. I've started over here in our cardiac clinic talks.
Oh, wonderful.
And the doctor is quite pleased to say it is a new approach to patient education. It has grown actually. However, it can be done here.
So you find a lot of doctors, really, welcoming that?
Very, very much so.
Wonderful.
Very much so. It's done every Monday, if I may say. I'm on the air, but I'm saying it. And we patients are aware. It's not because they are not aware of general healthy eating and how to maintain a healthy habit. It's just, why is it not done? It's to help more in prevention instead of probably just try the treatment. That's what I have observed, and I wish it maybe even trying to go out into the community and outreach areas.
Well, it's a wonderful thing you're doing, coming and sharing your expertise and,
Thank you.
and making people more aware of, what the standard is and what they need to do to, make their lives a little bit better. I'm trying to do the same thing with prostate, so that's great. I think that's fun, fantastic.
Nice to listen to your program again. Thank you very much.
You're
for
welcome.
listening.
All the best to you. That's
Thanks.
great. Thanks for calling.
Dennis, I didn't quite understand if she was calling from London or she's in Trinidad. Oh, okay.
So we
And,
we're gonna close to the
Yes, and
version.
I just wanted to say that, you know, in London, in Europe, we can go to a conference. In Europe, we can go to a conference every week, but here, you know, we don't have that. And also, these journals, like the British Medical Journal that was mentioned, all the others, they are fairly expensive, and you know, it's not so easy to have access to them. So that's why I was saying the doctor who wants to keep current ends up spending a lot more money.
Right. Like, we don't want to sound like, you know, we sort of beating up on the doctors, and I mean, maybe, you know, in a lot of situations, I'm sure they, you know, they just have never had maybe the opportunity to get that information or to raise the standards. So we want to create opportunities also for, you know, our local physicians to, you know, to get up to standard. It's not about you know, pointing fingers and calling names. You know, let's just, you know, make an effort to fix things.
Yes, we're just, you know, prodding them a little.
Just a little. You're listening to 103 FM's Men's Healthcare Power. My name is Dennis Webster, and you've visited with us and Dr. Cardone tonight, and our topic was evidence-based decision-making. It's time for us to close the show, so you've been listening to The Finest and The First, and we'll see you next week.
And good night, Trinidad.
Good night, Trinidad and Tobago.